Everyone, warm welcome for this health webinar on Stay Healthy, uh, which is to create the awareness about the flu. We are very privileged that we have Dr. Sharad Agarkhedkar, who is giving us the knowledge about the how to prevent the flu. Dr. Sharad sir is having experience of more than 55 trials with WHO and multiple vaccine manufacturer. He is having 175 publication under his belt and more than 700 citations. So we are really proud and really welcoming Dr. Sharad sir. Sir, welcome. And we are happy that you joined us to provide this webinar. Sir, over to you for this.
Thank you, Kronal, for that introduction. Good evening, everybody. Today we are going to talk about flu and how to avoid flu and stay healthy. Now, flu is a contagious respiratory viral illness. It is caused by the influenza virus. Influenza virus has type A and B. It can cause as mild cold like upper respiratory tract infection or running nose with mild fever to severe illness like pneumonia and difficulty in breathing. At times, it can lead to death. What are the symptoms of influenza? It begins with fever with chills, intense headache, body ache. It has running nose or stuffy nose, itchy throat, sore throat, and aches and pains all over the body. Fever is generally very high. And the typical feature of this influenza is that there is extreme tiredness or weakness. And because of the respiratory infection, the presenting symptom will be cough, followed sometimes because there will be vomiting also. And some people do show the manifestations of joint pains. So it can be as mild as a running stuffy nose with mild fever to high fever with chills and pneumonia, and then the patient can collapse because of desaturation. And also sometimes there are the effects on other system as well. And that's why it is not a very mild disease to be ignored. We should always take a note of this and try and avoid this. Now, influenza, how does it spread? It spreads from person to person. Whenever we cough and sneeze, we throw out millions of viruses out. And they are there within, say, 2 meters or 3 meters of our periphery. And it settles down on the surfaces. And it can also remain on the doorknobs and the bed sheets and the handkerchiefs. So if you share these things, then there will be transfer of virus from one person to other, and it can infect the other person. So if you have touched some surface, then the virus is on your hand. And if you rub your eyes or you pick your nose, then the virus will transfer to your system. And then the next person will get infected. In epidemics, we have found that the R dot, secondary infections from index case are very high, and that we have seen in the epidemic of swine flu almost 14 years ago. So, so there is a contamination of the doorknob, there is a contamination of the article used, and the persons coming in close contact will get infected. So this is how the disease spreads, and very much contagious and very infectious to the others. So by and large, the flu, we say, what has happened to you? We say something like viral or flu, but then it can be, there are very serious complications like pneumonia, a primary viral, and there can be when there is a viral infection, like as shown in the picture, there can also be secondary bacterial infection. And some people come with a mixed bacterial and viral infection. Now, the virus enters in your respiratory system. It breaks the mucosal lining of our respiratory system. There are bacteria always present on the respiratory tract. The bacteria get easy access to the deeper structures and then they cause the infection. The virus attacks on the ciliary lining of our nasal mucosa and the respiratory tract. The cilia are shed off, the cells are separated, and the virus goes down. Along with the virus, the bacteria go in, and that causes severe disease. The most of the people who get influenza recover completely, but there are certain group of people who have cardiac condition, like they have heart disease, rheumatic heart disease, congenital heart disease, or ischemic heart disease, or those who are chronic smokers, who have asthma, and those who have COPD, chronic obstructive pulmonary disease. These people will be particularly vulnerable to get serious influenza infection, and it can be life-threatening in them. So these are the patients who should take care of this influenza season. And as we all know, the virus, generally we see this is the present season is the season when we get maximum cases of influenza. And during the corona pandemic, first year we did not see any case of influenza, but second year onward we started getting influenza cases. And in the third year, in 2023, we are getting more cases of influenza in the children. So this is how the disease is behaving. And as I can say that the virus changes, there is a natural shift and drift in the virus. And this changes in the structure. The virus, the most common three strains of influenza A and B viruses are identified in both the hemispheres, northern and southern hemispheres. And within 6 months of identifying three most common strains, the vaccines are developed by the vaccine manufacturers. So there are two groups, southern hemispheres and northern hemispheres. In northern hemispheres, in USA, Europe, Canada, these countries, there is a prevalence of pneumonia in the months of winter. And whereas in southern hemisphere like us, it will be more seen in the rainy season, like a present season. And that's why every year we have to develop a new vaccine with the three new strains. And the vaccine immunity is strain specific. And that's why the vaccine needs to be given to children under 5 years every year. So before we take the vaccine, what simple things you can do is clean your hands, wash your hands with soap. Because of corona, we all are very much trained to wash our hands, use sanitizers, and avoid touching our eyes and nose. We cover our mouth and nose when we are coughing and sneezing. So this cough sneeze etiquette is to be strictly followed. And spitting on the road should be avoided, which is very difficult to achieve. We did achieve in the corona pandemic as well as in the swine flu pandemic, but now we're back to normal again and we're spitting freely on the streets, which should be absolutely avoided. We should avoid close contact with any person with influenza. And if you are sick, then you stay at home and avoid touching your eyes, nose, and mouth. So how can you prevent it? Wash your hands. Then avoid touching your eyes and nose. Then avoid being around sick people. Then you stay indoor if you are suspecting that you have got the infection so that you don't spread it to others. Use of mask as shown in the picture. And the most important thing is the vaccine is available. You should take the vaccine. So you are protected against the three most common strains of virus. And you will be protected from getting serious disease. So that is how we can protect from influenza. Most of the people will say before 2005, before SARS came in, we people were not aware of this influenza. The vaccine was not there in our schedule. But the swine flu pandemic has taught us a lesson, and then the people are aware about this vaccine and they are coming forward to take the vaccine. Even before the corona vaccine was available, people were taking influenza vaccine thinking that it will protect them against corona, but it was not protecting against corona, but the complications of corona were caused by secondary infections and influenza and pneumonias, and those were prevented. Now, can this flu vaccine help? Since I have done almost 10 flu vaccine studies, I can confidently say that it does. It does protect. There are various types of vaccine. There are live nasal vaccines as well as inactivated vaccine. Now there are split virion, then whole segment, and other types of vaccine which are available. There are monovalent vaccines are available now. Trivalent vaccines are being made now. Even quadrivalent vaccines are now available in the market. The quadrivalent vaccine is, of course, the most important because it protects against 4 different strains. So this is how the vaccines are available. It gives immunity and it protects you from the serious illness. How the infection with the influenza, there is a memory in your body, and it is lasting for lifelong with that particular strain. But the important thing is the vaccine changes its character. The virus changes its character every year. That's why there is a need to take the vaccine every year, especially for children and for the people who have heart disease, those who have chronic obstructive pulmonary disease, those who are having immunodeficiency, and those who are having uh, chronic lung diseases. So that is why the vaccine is recommended to these people and to the extremes of age. In the age above 65, people are vulnerable to get pneumonia and influenza. So it is recommended to old people to take this vaccine that will protect them from these terminal illnesses. So this was all about the influenza, how to prevent it, the vaccine, how it is prepared, and how it protects, and the types of vaccines, as well as the why it needs to be taken every year, and who are the people who should take this vaccine regularly. That's what we have discussed. If there are any questions, you can ask.
Uh, Sir, what you said is rightly, to the point, and it's extremely useful to understand the sensitivity and how to protect it.
Yes.
I have one question. People think the flu is very they just confuse between the cold and the flu, and they don't take the proper precaution, and obviously gets impacted because of that.
Yes.
So do you have any advice, how we can understand that it is cold or flu, and at what point of time we should go and consult the doctor?
Yes, it's a very good question. When you have got only stuffy nose or running nose and only mild fever and no constitutional symptoms, then you can ignore it as some cold. Like there are other viruses like rhinoviruses which can cause cold. But if you are having extreme body ache, extreme weakness, fever with chills, and inability to get up from your bed, then it can be influenza. Don't ignore it. This is how we can differentiate safely. The common rhinovirus infection will be mild, but influenza will not be mild. It will manifest in this form that there will be extreme body ache, there is extreme weakness that is called asthenia, and if the lungs are involved, then it will cause breathlessness. So if you are having breathlessness, don't sit at home, seek medical help. Because if you are having only viral infection, it can be treated. Even influenza can be treated with drugs. and if it is bacterial, then you need to take antibiotics. So we have to consult a doctor who will differentiate between common cold and influenza and guide you properly. Thank you.
Thank you very much, sir. Sir, as a pediatric, you must be helped many children. So want to understand, as children are very going out in the school, playing outside with other people. So what precaution one parent should take, that they can prevent flu to happen to their kids?
When children are going to school or daycare, they are exposed to infections and they will get the infections. But if you have given the vaccine to a child less than 5 years, in the first year, on the sixth and seventh month, if you give 2 shots, and thereafter every year 1 shot before the rainy season, then they are protected against the influenza. So you need not worry about. All other infections will keep on happening. Even if you give the flu shot, that does not mean that he will not get rhinovirus infection or any other virus infection, because we don't have vaccine against all the viruses. So, but influenza can be definitely prevented, and we have been using this vaccine for last 20 years with good results, with very, very minimal side effects. Initially, when doctors were offered the influenza vaccine, they were scared because they were scared of getting paralysis following the vaccination. But that was so wrong belief by the doctors that I have myself given thousands of doses of influenza vaccines in open public in the schools of corporation, and I have not seen a serious reaction so far in last 20 years. So that I can say certainly that the vaccine is safe and it is effective and it protects you definitely against serious form of influenza infection, and it protects people around you also, because if old people are given and the children are given the vaccine, the virus does not enter into your family. So that is the simplest way in which you can protect your family by getting immunization. And the flu shots are being commonly given in Western world. We were not aware before 2005, but now at least people are aware and they are taking the vaccine. But the percentage of people taking this vaccine should go up so that we don't spend on hospitalization and antibiotics in the treatment of these illnesses. Thank you.
Thank you, sir. That was very insightful and really helpful to understand. As a parent, they are always worried about their child, and flu is something very common. So your advice is really helpful, and all the parents should follow this, because to prevent the flu to happen.
Yes, yes. Any other question?
So anyone joined the webinar, if you have any question, feel free to ask Dr. Sharad. Okay, sir, we have a question. How long does it take to develop symptoms of influenza after being exposed?
The incubation period of influenza is around 5 to 7 days. And after you come in contact with the index case, you might start getting sore, scratchy throat and red eyes and little stuffy nose. And then you start with fever, with chills, fever, high fever and body ache. So that is 5 to 7 days you will definitely manifest with symptoms. And the disease ranges from mild illness to extremely serious illness depending upon the other comorbidities present in the person. So that is a very important thing to take care of.
Okay. We have another question from Dr. Divya, that how about the adults? As for people 18 plus of age have already been exposed to many virus. So do you think vaccinating the adult is important?
Vaccination in adults is important. I think, as I said, the extremes of both the ages, 65 plus and those younger than 5 years, should be mandatorily given the vaccine. One. Secondly, those who are having heart disease, those who are having chronic obstructive pulmonary disease, those who are a case of bronchial asthma, and those who are immunosuppressed due to some reason should take this vaccine definitely. And those who are on chemotherapy and who have recovered from the cancer and they are in relapse, they are in remission, they should be given this vaccine, because once these all suppressions are given, your body's immune mechanism is suppressed, so you will be not able to fight the infection. And it is also important people who are on long-term steroids. So these are the patients who should essentially take the vaccine. And in Western world, what they do is all the grandparents are given this vaccine. Then if there is somebody is going to be pregnant in the family, the all other members of the family are given the vaccine, so that the virus does not come in the family in first 6 months of life. Because anyway, after 6 months, we are going to give the vaccine to the child, infant. But before that, the baby should not catch the influenza virus. So this is how the whole family is protected and the baby is protected indirectly. Right?
Yes, sir, absolutely.
Hmm.
We have one more question that parents are usually scared that if they vaccinate their child, they will fall sick and eventually they will miss school and it will delay or postpone. So what is your advice to the parents?
After influenza vaccine, at the site of injection, they will get paid and they will get fever up to say 100.5 or 101, which can be controlled with antipyretics like paracetamol. So, and if you give it at the weekend, like Friday evening, then by Monday, the child should be absolutely fine. So they don't miss on the school, they do not miss on their activity. If they get influenza, then they will miss a week or two in the school, a week or two of their sports activity, week or two of their cultural activity. So, and besides, because of hospitalization, you are spending a lot of money. So instead, if you give the vaccine, all these things are avoided, your expenses are avoided, and the child is playful and active and doesn't miss on the school.
So thank you very much for that answer. I think we have no further. Then there is, I think, one question related to is there any a different vaccine for the senior citizen or people more than age of 60, 65?
No, the same vaccine is being given to the senior citizens. See, whenever a vaccine is manufactured, it goes through a lot of tests. So it is first there are the animal studies, then there are preclinical studies, then there's phase 1, phase 2, phase 3. And then there is phase 4, which is a post-marketing study. So I have done the study in the age groups of 5 to 15. Then I did between 3 years to 5 years and 15 years to 18 years. And then I did for over 55 age group. So this is how, when the studies are conducted and the results are analyzed, then the vaccine is manufactured for all those groups. The dose in infants less than 3 years, in the children, toddlers less than 3 years, is half the dose of adults. So the adults and old people get the same vaccine and the dose. Children get half the dose.
Okay, yeah. Thank you very much for that, sir. I think we don't have any further question in the chat. So I think it was a wonderful session, and we are really thankful to you, sir, that you gave us all the knowledge and equipped us to how to fight with the flu and how to protect our family. So thank you very much, sir, and thank you everyone for joining this webinar.
Thank you.